Hi, Eileen Veilleux, the fam here. Welcome to a new series in our mini mental health series. And on this series, we're going to be covering Tourette syndrome. But before we begin, let me just remind you that in this video, there will be 3 keywords. So make sure you watch the full video. And in the comment section, along with your genuine comment about the video, put down the 3 keywords to be entitled to free merch giveaway when I reach 2,000 subscribers. So saying that, let's get started here. Okay, Tourette syndrome is a disorder that involves keyword, repetitive movements, or unwanted sounds, or tics that can't be easily controlled. For instance, you might repeatedly blink your eyes, shrug your shoulders, or blurt out unusual sounds or offensive words. Tics typically show up between the ages of 2 and 15, the average being around 6 years of age. Males are about 3 to 4 times more likely than females to develop Tourette syndrome. Although there is no cure for Tourette syndrome, treatments are available to help control some of the tics. Many people with Tourette syndrome don't need treatment when symptoms aren't troublesome. Tics often lessen or become controlled after the teen years. Some of the symptoms of Tourette syndrome is tics, which is a sudden, brief, intimate movement or sounds, are the hallmark sign of Tourette syndrome. They can range from mild to severe. Severe symptoms might significantly interfere with communication, daily functions, and quality of life. Tics are classified as a couple of terms for them. Simple tics are just sudden, brief, and repetitive tics involve a limited number of muscle groups. Complex tics, these distinct coordinated pattern of movement involve several muscle groups. Tics can also involve movement, otherwise known as motor tics, or sounds, vocal tics. Motor tics usually begin before vocal tics do, but the spectrum of tics that people experience is diverse. Some common motor tics seen in Tourette syndrome is, we're going to go over both the simple and the complex. Some of the simple tics is eye blinking, head jerking, shoulder shrugging, ear darting, nose twitching, and mouth movement. The complex tics, touching or smelling objects, repeating observed movement, sleeping in a certain pattern, obscene gesturing, bending or twisting, and hopping. Some common vocal tics seen in Tourette syndrome. For the simple tics, grunting, coughing, throat clearing, and barking. Complex tics, repeating one's own word or phrases, repeating others' words or phrases, using vulgar, obscene, or swear words. Okay? In addition, tics can vary in type, frequency, and severity. Worsen if you're ill, stressed, anxious, tired, or excited. Keyword, occur during sleep. Change over time. Worsen in the early teenage years and improve during the transition into adulthood. Before the onset of motor or vocal tics, you'll likely experience an uncomfortable bodily sensation, premonitory urge, such as an itch, a tingle, or tension. Expression of the tic brings relief. With great effort, some people with Tourette syndrome can temporarily stop or hold back a tic. Now, when should you see a doctor if you have Tourette's? Because some, as we just learned, some um, Tourette syndromes do not need medical care if they're not severe. Mild Tourette syndrome does not need treatment. So let's go over when you should see a doctor. You should see a physician if you notice your child or yourself displaying involuntary movements and sounds. Note not all tics indicate Tourette syndrome. Many children develop tics that go away on their own after a few weeks or months. But whenever a child shows unusual behavior, it's important to identify this cause and rule out serious health problems. Some of the causes of Tourette syndrome, the exact cause of Tourette syndrome isn't known yet. It's a complex disorder likely caused by a combination of inherited or genetic and environmental factors. Chemicals in the brain that transmit nerve impulses, or other known as neurotransmitters, including dopamine and serotonin, might play a role. The risk factors in getting Tourette's is a family history. Having a family history of Tourette syndrome or other tic disorders might increase the risk for developing Tourette syndrome. Sex, not meaning in the bad sense, but sex meaning as male or female. Males are about 3 to 4 times more likely than females to develop Tourette syndrome. So Tourette is more likely to be seen in men, just like in Parkinson's. Some diseases, mental health disorders, for some reason, attack the males more than the females, which some of it may be from genetics. I don't know the reason why more men in certain cases are more prone to getting things like this or Parkinson's than the females. I would simply say it's probably more of a genetic code or, the makeup code. Complications. People with Tourette syndrome often lead healthy, active lives. However, Tourette syndrome frequently involves behavior and social challenges that can harm your self-image. Conditions often associated with Tourette syndrome include ADHD, OCD, autism spectrum disorder, learning disabilities, which, by the way, keyword learning disabilities, sleep disorders, depression, anxiety disorders, pain related to tics, especially headaches, anger management problems. So that's the overview of Tourette syndrome. As you can see here, it also states Tourette syndrome is a nervous system disorder, which we just went over. And it shows here patients can continuously blink or clear their throat in this syndrome. So a person with Tourette syndrome might constantly go like this. They could do, shoulder shrugs, mouth movements, nose itches. That's why it's so important for me to get this out to you so you can learn. So if somebody's constantly swearing, you don't know, they may have Tourette's. I'm not saying to, let all swearing go. But if you talk to them and you notice, besides maybe that tic, it's something else, it could be Tourette. So that's why we should never ever judge a book by the cover. If somebody doing something that looks strange or odd to us, Don't pass judgment on them. See with your heart and not your eyes. Your eyes is just going to see something that don't look right or hear something that doesn't sound right, and you're going to react. But if you see with your heart thinks, what's the reason why? Why are they doing? What's causing that? Could there be a medical condition behind it? It's so important for us to learn to see from our hearts and not from our eyes. Because what the eye see isn't important at all. The only thing that's important is invisible to the eye because only the heart can see it. So to remember, always see with your heart and not your eyes. And until I see you again, remember, you matter and you are very important. Love you. Bye.